Hi friends, I'm Dr. Swapna Chekuri from Hyderabad Women and Fertility Center. Welcome to my channel. So today, most of the antenatal patients who comes to the OPD in the first 3 months, what diet we need to take, and so many queries they have regarding the diet. So today let us discuss in detail. So basically in the first 3 months, as such, the baby size is very small. So the mother doesn't require too much of extra calories in the first trimester. But still, there are few basic minimum supplementations which they need to take in the first trimester. Most important is the folic acid, because that helps for the baby brain and neuronal development, and even for the retinal development it's very much important. And even to prevent neural tube defects, the folic acid is mandatory in the first 3 months of pregnancy. And of course, even till delivery also it's mandatory, along with the DHA supplementation. And apart from that, vitamin B12, vitamin D supplementation and vitamin C is also equally important in the first 3 months of pregnancy, because even that helps for the neuronal development of the baby. And most important is we advise the lady to have food of her choice. Anything, whatever she want to eat, she can have, but provided excessive spicy masala items, oily deep fried items, those things she need to avoid. Because see, in pregnancy what happens, as soon as the pregnancy is confirmed, there will be increased progesterone secretion. So with that they'll have belchings, acidity, gastritis, and even the digestion capacity also will be reduced. So that's the reason we ask them to avoid oily fried items and outside bakery items. Those things they need to avoid. But otherwise, food of her choice which is prepared at home, she can have. And then most important is we ask the lady to have small and frequent meals, because too much also she can't consume at a time. If she takes forcefully also, they'll have vomitings. And some individuals, they have this nausea and vomiting sensation in the first 3 months. So for those individuals, they need to take some precautions. Early morning, we ask them not to take water or any liquid diet early in the morning as soon as they get out of the bed. So better they have some solid breakfast, and after that they can have either water or fruit juices or coconut water or milk. At least give a gap of 1 to 1.5 hours after breakfast. That's the ideal thing. And some individuals, they keep on vomiting. Even if they have water also, they'll have vomitings. So those individuals, just to prevent the dehydration and to prevent any recurrence of urinary tract infections, we advise them to have liquids. If not plain water, they can mix some electrol powder, or they can mix some glucon-D powder in that, or they can have coconut water, or else they can have buttermilk lassi, and then sabdan ganchi, sapudan syrup. All those things they can prepare at home and they can have. And even soap water, that also gives so much of relief for acidity and gastritis during pregnancy. And even barley water also they can take. So anything of their choice, but we ask them to have adequate liquids just to prevent dehydration and to prevent urinary tract infections. So these are all mandatory diet. And then apart from that, whoever have excessive nausea and vomitings, we ask them to take dry food in the sense dry fruits. Let them eat little bit, but whatever food they are taking, let them take a good protein diet, and which includes dry fruits, pulses, sprouts, salads, all those things. And apart from that, they can have this murmure and puffed rice and cornflakes, oats. So these are all dry items, biscuits. So even these things, they reduce little bit of nausea and vomiting. And for some individuals who become very weak because they may not be able to take adequate diet, those individuals, they can have bananas, because see, that's a rich source of glucose. Instantly they'll get glucose energy levels in the body. At the same time, that reduces the nausea and vomiting sensation during pregnancy. So that's the best diet in pregnancy, especially who have excessive nausea and vomiting. And we usually advise them to have a properly cooked non-veg. Some individuals know they have this raw salmon fish dipped in vinegar as salads. So those things they need to avoid. And even milk also, unpasteurized milk they are not supposed to take. Properly boiled and cooled milk they can take. Even if they want to have some cool milk shakes, so it's better to avoid unpasteurized milk. So these are some precautions which they need to take. And we usually ask them to take more of green leafy vegetables, fruits, salads and all, because and those things also should be properly washed either in vinegar water or in salt water, just to prevent this pesticides and some chemicals they'll be using, right? So those things has to be washed properly before they consume. So friends, if you find the video is informative, please like my video and share with your friends and needy people. Thank you.